Hello, welcome to the Northern Devon Healthcare NHS Trust, and we hope you'll enjoy working here. Before you get started, there are some important things you need to know. This short film is to introduce you to the policies and procedures which underpin the NHS services we provide. It's designed as a toolkit to signpost you to more information and tell you what we expect of you as an employee. The Trust prides itself on offering a safe service to patients and reducing the risk of them coming to any harm in our care. For however long you're a locum with us, we expect you to play your part in contributing to our aim of high quality care. This DVD and toolkit are part of your introduction to the Trust. Regardless of what time of the day your shift starts, you should watch this film and use the website to familiarise yourself with the way we work. Human Resources have informed you by now of where you have to go and whom you have to report to. Usually we expect locums to turn up about 20 minutes before their shift starts, allowing time to make sure you can access the IT system and for the staff in charge to give a handover of the patients you'll be caring for. You also need to know how we code our clinical care, including comorbidities, diagnoses and interventions. A brief explanation is on the Locum Toolkit website. There are 3 essential things to know. 1. Phone numbers. There are 2 important phone numbers. In case of a cardiac arrest, call 2222 from any phone. If the patient hasn't yet collapsed, 2333. 2. Computer access. Like all other staff, you're authorised to have access to patient information to perform your duties. We expect you to abide by the universal policies of handling and accessing confidential patient information. All reasonable care should be taken to protect the security of confidential information. Don't share your username or passwords with anyone, and don't leave paperwork where patients or visitors can see it. The locum area of the website will tell you more. 3. The website. In the website toolkit, there's an information sheet for every specific issue. As a bare minimum, please read this before starting your first shift. In particular, you need to know medicines policy, infection control, venous thromboembolism, access to pathology and radiology results, the surgery checklist and hospital formulae, the agreed list of first choice drugs. We expect all staff to follow the medicines policy when prescribing medication. Obviously, extra care is needed when prescribing high-risk drugs. These include anticoagulants like warfarin, as well as insulin and opiates. If you're filling out a prescription chart, write legibly. Indicate the dose, duration and route of administration. You should also print your name and include your GMC number. If a medication is changed, stopped or needs to be omitted, that needs to be documented in the healthcare record. Every single member of staff, regardless of their role, is expected to comply with our infection control policy. This can be found on the website. This trust has a good record of compliance with hand washing, 94%, and is consistently within the targets for MRSA and C. diff. But we can only keep this up if everyone who works here makes a concerted effort to maintain excellent standards in hygiene and patient safety. There are 5 critical moments when hands should be washed: before touching a patient, before a clean or aseptic procedure, after the risk of exposure to body fluid, after touching a patient or their surroundings. Others include after removing gloves or aprons, before preparing medication or food, and after going to the toilet. Any individual who shows poor hand hygiene will be challenged by the Trust. We can't stress enough how important it is to keep accurate legal healthcare records. You should provide a clear indication of the status of the patient and their ongoing care plan. Entries should be dated using the day, month and year, timed using the 24-hour clock and signed. You should print your name and document your designation. The full clinical record-keeping policy is available on the website. We expect every patient on admission to be assessed for their risk of developing venous thromboembolism whilst in our care. More information can be found on the website. Patients should be assessed before surgery, and anyone identified as at risk should be prescribed the appropriate chemical and mechanical prophylaxis. Risk is to be reassessed 24 hours after admission or on the first day after an operation. We want all members of the team to feel they're able to raise any safety issues before, during and after surgery. We expect everyone on the theatre team, including the anaesthetist and surgeon, to participate in completing the World Health Organisation's surgical safety checklist, normally known as Time Out. The NPSA website will tell you more. Before watching this video, you should have been given a login password to gain access to the radiology and pathology systems. If you haven't been, please tell the member of staff who gave you access to this video so that this vital information can be passed on. In terms of your own safety at work, there are a number of regulations and procedures you need to be aware of. These include fire safety and security, health and safety, incident reporting and moving and handling. Obviously, these impact on patients too. One of the first things you should do when you arrive on a ward is to find out where the fire exits and assembly points are. All areas have fire safety plans. Ask the nurse in charge. Fire alarms are tested briefly on Tuesdays. If an alarm is activated in the ward or department you're working in, there'll be a continuous ringing. If the sound is intermittent, it's in an adjacent area. Smoking isn't permitted in any of our buildings or grounds. The Trust has a legal duty to protect the health and safety of employees and others who may be affected by their work, such as patients, visitors and contractors. It has to ensure that staff are trained and competent with safe working procedures. Health and safety is everyone's responsibility though, and you yourself must take reasonable care by only doing what you're able to do, not putting yourself or others at risk, and reporting any concerns you may have. The most common injuries to staff involve needles or sharps, or result from slips, trips and falls, or inappropriate moving and handling. We expect you to be up to date with your moving and handling training and to use the recommended techniques, including the use of lifting aids. Report any shortfalls or defects in equipment to a senior member of staff. In terms of incidents involving patients, slips, trips and falls are by far the most significant, as well as collisions with objects. The Trust has a health and safety manual. Each ward has risk assessment folders, including one on control of substances hazardous to health. The National Patient Safety Advisory Service recognise this Trust as having a good reporting culture. Incident report books are located on every ward. Simply ask a member of staff. At the front, you'll find a step-by-step guide to completing an incident report form. You'll need to fill out one of these if you're involved in any sort of incident in a clinical context or not. An incident is defined as any event that has given rise to actual or possible harm, such as injury, patient dissatisfaction, property loss or damage. Leave your contact details on the form in case we need to get hold of you later. Should you require further help, the incident report book also has contact numbers for the corporate affairs team. Lastly, being subjected to violence and aggression is not part of the job, and the Trust has a policy to manage this type of incident. At North Devon District Hospital, a police officer's on site Monday to Friday during the day. At night, there's a security guard based in the emergency department, but cover is not around the clock 7 days a week. If you need help, call the switchboard on 0. At our community sites, there's no security backup. Simply call 9 for an outside line, then 999 for assistance. Ending on a brighter note, we hope you settle into your new role quickly and find your time here enjoyable and informative. Thank you for helping us deliver the best possible care to our patients, and thank you for watching. And by the way, if you haven't had enough form filling by now, I'm afraid to tell you, you have to complete another one to say you've watched this film.